Our last in-person event was in 2019, so very happy about that. I also would like to thank and acknowledge our generous sponsors, and I'm just going to list them for you. 1199 SEIU, United Healthcare Workers East, AARP New York, Dally & Marino, Sherborne Electronics Inc., the Rizzuto Law Firm, Martin and Marcia Petrov, PHI, John W. Rodat, Public Signals LLC, Medical Legal Nurse Consulting Services of Westchester, Patricia Faldos, Vosberg and Keith Vosberg, and Valerie Bogart, NILAC. Thank you again to all our generous sponsors. Thank you all. Thank you all also for coming out to support LTCC tonight. It means so much, and we do appreciate it. And I now have the pleasure and honor of introducing Richard Mollett, our Executive Director of LTCC.
Deb, thanks very much. This is so fancy. Well, thank you all very much for coming. It is really exciting to be back in person. I wanted to thank Deb and Eric and Haley and Sarah and Stefan for your work on this program, including the program itself, and making today. Unfortunately, our honoree Dick Gottfried wasn't able to make it today. He had a family commitment that came up, so I wanted to say a few words about him. Country, healthcare consumers really to being, to care, of course, and it's hard to think of anyone who was smarter, more dedicated, who really gets it, who really understands what it means to be a healthcare consumer, what it means to be someone who needs care to get it, what it means to be someone who is in a nursing home or in an assisted living or in home care, is facing challenges. The care and the treatment with dignity deserve to have in our daily lives. And I will personally really miss working with him. He was really marvelous to work with in terms and we thought, what can we do to fill the gap? But maybe we could have a so I am just beyond thrilled to be able to introduce Toby today. She came to the rescue for us and has been working on behalf of nursing home residents for many, many years. She was, implementation of the nursing home reform law, an implementation we're still working on to this day. If not not the most important voice on behalf of nursing home law came into being in 1987. It is
I don't know what you do with this. Just leave it there? Should I just leave it there?
Yeah,
Okay, I won't worry about it. Thank you, Richard, that was really nice. The feeling is mutual. Each other on, and it's a to see so many people here that I've known and worked with for decades. I mean, it's just absolutely phenomenal. And other people, but now, so this is really a wonderful. And my nephew and nursing home. Where are we now? Where do we need to go? The White House announced to President Biden's comprehensive nursing home reform agenda in February. The White House described why nursing home reform is so needed today. And an industry with little ability to keep American seniors safe and protected. COVID-19 has laid bare the challenges and staff dying from COVID-19, close quote. COVID-19 was a shocking wake-up call about nursing homes for many Americans. Without question, people under age 65. A major success is the federal nursing home reform law enacted in 1987. It describes quality of care. Provide all the services that each resident, not residents, each resident do when facilities do not provide residents with high-quality care. Changes. For example, it required facilities to have an infection preventionist. Hundreds of thousands program were enormous, billions of dollars. Regulations required all a person in and ensure full implementation of the purpose was to make sure we knew how to prevent and treat infections. But essentially, with few changes, the 2016 regulations repeated since the 1990s. These are still the care standards today. The exception to the adequacy of the 1987 law is staffing, particularly nurse staffing. The law requires very little. Licensed nurses around the clock, and otherwise, quote, sufficient staff. As a result of this lax standard, Most facilities do not have enough staff to provide good care to residents. More than 20 years ago, the federal government released a 4-volume report that found that more than 90% of facilities did not have enough staff to prevent harm or to meet residents' needs. Shockingly, nursing home trade associations admit today that more than 90% of facilities still can't meet those staffing standards identified in 2000. And we know residents have greater care needs than they had 22 years ago. Decades of studies. The importance of staffing was repeatedly confirmed again during the pandemic. One study in Connecticut found that if each resident received 20 minutes more of care by a registered nurse, the facility had 22% nurses' time made such a difference. New York Attorney General James similarly found that facilities in New York that had more nursing staff had fewer COVID cases and deaths. Most deaths occurred in nursing facilities with the lowest staffing levels. The other failing is not in the language of the reform law, but in its implementation. When the law was passed in 1987, the only sanction that could be imposed when a facility failed to meet standards of care was complete loss of federal funding, a harsh remedy that hurt residents and was rarely imposed. The 1987 law set out a full range of immediate sentences. Unfortunately, even today, usually just the very worst problems lead to a penalty. The federal government office looked at infection control deficiencies between infection control was the cited problem in the entire country. Of the deficiencies led to too many facilities ignored infection control rules. And now with the pandemic, we see the consequences. We have good standards of care, and the administration has promised to create staffing ratios and is in the middle of preparing its recommendations. What we hear from nursing homes is that they can't hire staff. There's no one to hire, and they need more money. Staffing shortages are a serious problem. We know from the country, nurse staff, especially nurse aides, don't stay on the job because they're underpaid, have inadequate training, and are injured on the job, often because they try to take care of residents. Of staffing, the main problem is job retention. Poor staff and too few to provide care. Better working conditions could and keep good workers. As for the need for more money, it's not that simple. More money would not necessarily go to staff and resident care. Specifically needed for health, and these rules need to be. The importance has been made clear in the case nursing homes to spend designated amounts of their reimbursement on care. Effective this year, New York's budget law requires facilities to spend 70% of their revenue on care and to have profits of no more than 5%. Just before the law was to go into effect in December, 230 $824 million to the state. Think is that they did not use 70% of their revenue on care for residents were above 5%. A close look at some of the facilities that filed the lawsuit. One facility, quality facilities in the country, identified by the federal the budget law had been in 20. When facilities, I saw that the state had cited it in May. Just a little more than half of 11 certified nurse instead of Eric Haley, owners and operators of nursing homes. It is important to know who is to residents so that operators who provide poor care are not called mom and pops and publicly one of the worst facilities in the state. In 2018, the New York Attorney General prosecuted the facility year-old resident in a recliner. The company and its owner and manager pleaded guilty to various December. The facility more than $14 million. Lawsuit I spend enough on residents. 29. When I looked at the facility on the years, a survey of the problem. As a country, plans efforts and accountability about nursing homes. We can, we must, and we will do better. Thank you.